to start the presentation.
Okay, thank you, Matteo, and thank to all the friends that are here today. I just switch the screen. Tell me if it's correctly viewed.
Yes.
Okay.
It's okay.
So our idea was not to be the teacher, but to share experiences, because up to now it's only 2 months that we have this problem, so nobody has the revealed truth, but just some sharing experiences and maybe some practical things that are not written on paper. I would like to start just to introduce a few words about the pathophysiology of COVID-19 and their interest in neurophysiology, just because we know that this virus is especially active on ACE2 receptors that we find especially in the nose, in the nasal passage, in the goblet secretory cells, but in the lungs where we have the pneumonia, and also in the intestine. But these receptors are diffused all around the body. And we know the direct mechanism of damage done by the virus, but especially there is another mechanism that is on blood regulation and coagulation, because when we have the saturation of the ACE2 receptor, we have an overexpression of ACE1, so we have a lot of problems in the body, and it means that we have a problem in blood circulation, hypercoagulability. So that's the reason why we have also a damage due from stroke attack. So the neurological syndromes are described in a lot of patients. Up to 35-40% of patients, they have neurological symptoms, from mild to severe, from transient problem to strong ischemic attack. But we have also, and start to be described, an attack or an immunological reaction, like Guillain-Barré syndrome for nerves, roots, and spinal cord. So we have to consider this also a disease with a strong interest for us who practice electromyography. And the problem is that in some patients, the neurological symptoms were the first sign of the viral disease. So if we have to compare with polyradiculonephritis now, we have to think seriously that it has probably a COVID-19 or maybe an infectious patient, and we have to protect ourselves. And this is the new fear, because we were used to compare us to infectious diseases, but transmitted by blood, HIV, hepatitis, and other diseases. So this is the first problem that we have with the virus that is infectious with simple interhuman contact. So this is a problem not only for the health workers, people working on the patient, but also for all the workers in a medical structure, from the secretary to the cleaning people, everybody. So this is a problem for safety. And there is also the problem that now when we ask an EMG, ENG exam, we have to consider if this test is useful or harmful, necessary or not, or is better to do it or postpone it because of the safety of people. And just a few days ago, we can find some advices from the group of the American Academy of Electrodiagnostic Medicine about practical guidance, and this is focused mainly on how to select the patient. But how do we feel? Because when we see the classification of patients, the COVID positive, the COVID uncertain, the COVID negative, we must suppose that the swab test, it's easy to be done. And this is not a reality. We have a limited number. So how can we do? I think that an asymptomatic patient is a potentially dangerous patient. So we have to be really, really careful. And this is what we do normally for the other patient. If we examine a patient, we treat him as a potentially HIV, HCV, or ABV positive. So we are used in our mind to be protected and careful. Just because we are all afraid to bring the virus at home, and also because in this particular moment we may have a problem of cross-contamination. We may infect ourselves, but also other patients. So maybe some medical legal issues may be done in the future. This is the COVID-19 word distribution. Just a few words, because Italy was the first struck country in Europe, so we followed China with the severity of the problem. And this what happened. This was the big problem because it had a strong impact on the health system, because in the last day of March and in the first day of April, we have a problem in the intensive care units. We had to double the beds, and we reached the limit. Luckily, we have now a descending curve. But if you see the number, we had 223,000 infected, certified, and 31,368 deaths today. But the discussion with the Belgian colleague is that because if you consider the infection ratio for million of inhabitants, Belgium has a problem too. But we are facing the summer, and in the other part of the world, in the South America, the winter is arriving. So I pass the word to Carlo for this description.
Hello, everybody. These few slides, will be self-explanatory. You can see these numbers was for yesterday, and you see the world and the cases and the number of deaths. And then the next, please. Europe, you are much is your reality. Then you can see Europe, and the next, please. Here in South America, you can see. You have to understand that many countries. I have to say all countries don't have many exam to see if population are or not COVID-19, and this is under estimate case is very there are reality. Our reality is that we don't have how to see if patients has or have or not coronavirus. Okay, and the next, please, Alessandra. This is our the next the before. Yes, this one. Okay, the next, please. Yes, I said this is a joke, of course. Brazil was a big country. You can see almost all Europe is inside Brazil, and I said we said in Portuguese Brazil is right with S, not with Z, and you see that there are many different cultures inside our country, and your Europe is like our country, but of course much more people. And the next, please. Then many cultures, the same language, but many cultures, especially I live in the south, where you can see the red arrow, and but the countries, for example, from Amazon, as yes, this one, and to the right, you can see many little states like Ceará and Pernambuco are very lots of case, but especially in São Paulo and Rio. Yes, this is São Paulo, and the other is Rio. And São Paulo was the first case in Brazil. The first case in Brazil was by our authority was in February 26. A businessman came from Milan in Italy, but we know now that until January 23 we have case here in Brazil, and you can see to the right slide where is Brazil in how many deaths and the mortality. And I'm afraid that now, after United States, maybe Brazil could be a place where in the center of this pandemic, because there are some problems from communication between among the authorities. But this is another question. Then I think now is Alessandro again.
Yes. So what we have to do when we are about to examine a patient. So if a patient is hospitalized, an inpatient, we have now normally all the protections, and we have to use and to follow the guidelines given by the institution. But in our cabinet, in our medical room, in private activity, or in the other consultation, we have to do something different, because people, they are living at home. So the advice is to, if we have the possibility, to make a screening 24 hours before the exam, and or electronic form if we have the possibility, a computerized secretary, and the questionnaire is given again to the patient the day after. And this is the triage health diagram. So first, the fundamental question is related to the fact that if the patient had the COVID, if it's a patient that is negative now or is still in a quarantine, and if he has major symptoms, fever, cough, breathing difficulties, and one of the strange symptoms now that we know about COVID-19 is ageusia and anosmia, and localization, as I showed before, in the eye, conjunctivitis, or diarrhea for the intestine. And then some epidemiological screening, the exposure of the patient, if he was in contact to verified cases or to suspected cases, or with families of suspected cases, or if he lives with people with fever but no test, or other influential symptoms, or if he's an health worker, because we are a risky people. And then some questions about work, if he works with other people, or like many of us in this period, he is doing smart working from home, in which place, or if he has traveled in the last 14 days. This scheme you may build by yourself. You can find it. These are just the ideas. And I will pass the word to Federico, to Francesco, Francois, sorry, there is my son arriving, and to explain this computerized screen.
Yes, you can see here the experience, the Belgium experience in our hospital in Liège, Belgium. The medical secretary phones to each patient the day before the appointment to complete an electronic form like this, with several items about symptoms related to COVID infection, as for instance headache, fever, loss of taste and smell, etc. Other question concern the onset, of course, of these symptoms. Is the patient belongs to the medical or paramedical profession? Is the patient recently in contact or not with a proven COVID case? If one or more items are positive, the medical doctor concerned is alerted and he decides if the appointment has to be maintained, cancelled, postponed, or transformed in a telemedicine consultation. Next slide. Here you can see the translated electronic form, but it is the same. Okay. Alessandro.
Yes, sorry. So this is the waiting room and what we have to do. Um, some rules maybe are really important. The patient is allowed to the waiting room and to the medical room with mask and gloves. And if he has not the possibility to have it, we must give him. We have to limit the accompanying person. And if it's necessary, an accompanying person. If not, the patient must come alone and taking the temperature to the patient and the temperature of the accompanying patient. So we have to complete again the questionnaire and to protect the people working, the other workers. Maybe some plexiglass screen are a good idea. The number of people in the waiting room is important. We have to keep the interpersonal distance, separate entry and exit when possible. And in the lab, we were used, that is sad thing that we like to teach to each other, but now we have to think that we must have a limited number of people in the lab. And this is an example given from a colleague of mine, the chair for the patient or the companion person and the distance to the bed, and everything is simple to be cleaned and to be sterilized after. So just a few words about personal protection for me, just because one thing is that if we do not have people tested and the patient has to be examined, it's really important that he wears the mask, because there is a table about the exposure risk for healthcare personnel. And we have, if we have a contact with the patient with no mask, and in the next days he will become positive, we must be kept out of the job. So this is a strong impact on ourselves and on the colleague. I don't want to spend a lot of time about protection, because we all read every day, I think, a lot of things. But just in this period, we were all in shortage of protection. So just keep in mind that maybe the same product has different codes in different countries. So we must learn it to compare the safety of the product. This is an example, the difference between P100 and FFP3, like we have in Italy and in Europe. Is the same, more or less the same product, but we must know that what the number code means. And the body protection is important because it's important for our contamination, but also to avoid cross-contamination between patients. And we know that a disposable cap, a gown, the gloves and show covers are important. Some colleagues of mine suggested the use of a double glove also in the EMG cabinet. We will see it after, and it's very important every time to remember that we must avoid to touch our face. Here is the link when you will have the materials, people who will ask the materials, you will have the link with a procedure, one of the procedures to wear and unwear the protection. And the face protection is important. We have goggles or face shield. I been working with both. In my opinion, people like me wearing spectacles has a problem with goggles because they missed up. You have a fog inside after a few minutes. So I think that the face shield is much more aerated and better if you wear spectacles, but it's up to you. And this is to Carlo, the description.
Okay, this is a table for guidance. We are talking more about this guidance in a few minutes. But this is recommendations or rational and appropriate use of PPA. You can see inside the hospital, the area, the staff or patient activity, and we are talking much more about this now in this speech. Okay, but you can see what kind of material you can use. For example, healthcare professional, including technicians, with patients with COVID-19, medical mask, apron, all that we said and we are seeing now. Okay, then I think that now is you again, Alessandro. Yes.
Yes.
Excuse me, but we have a question about Elias Raji. Can I read it?
Yes.
Yes. How about if we are asked to examine a patient in the ICU to see if he has the critical illness neuromuscular syndrome, especially if this information is critical for deciding on weaning of the respirator? The question of ECU. Do you understand?
I will read it if it's possible. But anyway, the patient, if we ask, if they ask us an exam for critical illness, you mean?
Yes.
Yes, but
In intensive care, yes.
Yes, in the ICU now in Italy, in Europe, all the patients are tested. So in Italy, we are obliged to wear the complete full body protection with mask, with high protection mask, with face shield, and we have to respect the same procedures as our colleagues of the intensive care unit practice.
And another thing, this is to protect ourselves, but you have to protect too the electromyographer, the machine, like cables and other things. We will talk about this, I think, in the other slides. No, Alessandro?
Yes, we have some recommendation for a colleague of mine working in the most affected hospital for this disease. So we will show you after.
Okay.
So what may I go on, Francois?
Yes. Elias is okay. He answered. Thank you for.
Okay, ciao Elias. nice to hear from you. Hope to see you in person. And what we did today is just to think about the different tests for the different part of the body. So if we do the test in the lower limbs, the patient, the distance from the face is maximal, and that the patient may wear face mask and gloves. So he is protected, we are protected. He is not contaminating or reducing contamination. So for the examining doctor, the surgical mask and the face protection are recommended. The head cape, the disposable gown, and double gloves may be useful. It's up to you if you use one or if you do. But this is a distance from the breathing from the patient, so from the face. If we examine the upper limbs and not shoulders, the distance to the face is reduced, and the patient may wear face mask, but not the gloves. If we study median nerve or nerve, we have to record from the naked hands. So we must practice a perfect cleaning and disinfection of the hands of the patient. And again, surgical mask and face protection are recommended, head cape and disposable gown and double gloves. Then we approach, we are near to the face. So if we think about the recommendation to respect the interpersonal distance, our job is really difficult. And in this case, it's true that examining the shoulder, the chest of the back, the patient may wear the face mask and gloves, but we are so near that maybe increase the protection with an FFP2 or KN95 mask, and the face protection is better. And head cape, disposable gown, and double gloves, in my opinion, are recommended because we touch the body a lot. So it's better to think about the danger of a potential contamination. Then we reach the problem, the cranial nerves, and in this case, if we examine a patient with a facial palsy, but also most important disease as ALS, so we have to do a complete test of the cranial nerves. We must consider that the patient cannot wear the face mask. He can wear the gloves, but this is not very important. So we have to be really protected with a high protection mask and face protection. Then head cap and disposable gown and double gloves as before. This is because even it's a test with no aerosol. I've been discussing this with a facial surgeon or dental surgeon, but he may have a cough reflex, so the patient may produce aerosol and droplets. So this is maybe the most dangerous exam that we do. And if we consider the viruses localized in the intestine and the description of virus in the water of the town, of the discharge water, so the perineal area may be an anatomical part with probable contamination. So if we do perineal EMG, we have to consider the unknown and protect better ourselves. So again, even if the patient may wear a mask and gloves, again, to protect us with a high protection mask and face shield, and again the body protected. One part of the EMG is the botulinum toxin injection, and the same recommendation as before, because it's depending on the body, on the part of the body that's injected. But I do a lot of facial dystonia, so it's a complicated patient with the possibility of emission of droplets. Always try to learn by heart the procedure of dressing and undressing, because this is very important, because we have to undress, to clean, disinfect, then take other things. So we have procedures for this. And this is me. I was convinced to do the right thing, but a colleague of mine said, and the neck, you're not protected. So he invented this nice thing that is the neck protection when you practice EMG in a complicated patient with coughing, for instance. So he cuts the show cover and produce neck protection. And this is the way he taught me to wear the double glove, because we have seen in many publications to put the upper glove above the sleeve, but in this way, if you put the first glove up and the second in this way, you can take it away very easily, and you disinfect the glove, not the hands, because we have to consider that we still don't know which will be the side effect of the continuous exposure to disinfectant. Carlo, it's to you.
Okay, now was okay?
Yes,
okay.
Yes.
This is way that I work. Facial shield and N95 and gloves and apron or gone without head cap and without protecting the shoes. But this is the same, almost the same that our guidance from Latin America. For example, you can see the preferred PPA use, okay, 995 and higher or higher respirator. I think that, like Alessandro said, the glow, the just the Google is a problem. Who is using wearing these glasses? And another acceptable alternative is not an N95, but just a surgical mask. But of course, always with face shield. Okay, this is the way that I think is very interesting. I don't use wear two gloves, two pairs of gloves, just one pair, and I have to wash my hands and do my hands clean. Okay, now I think is me too. This is the way to all of us know now about this, but how to put on PPA and how to take off PPA is very interesting. It is not you have to put without touch your some contaminate parts of the body of the patient, of your body, or part of devices, or even in the handle door handle or something like that. Then we have to always think that the world changed, and you have to this in this keep this in mind. Okay. Then are you, Alessandro?
Yes, just a few words about the American Academy of the Electrodiagnostic Medicine, because they were really short, because first they have instruction, precise instruction for the general practitioner. So if you are a doctor, you must know a lot of things, but they give just a scheme for positive COVID or potential, and for all other patients, they suggest the surgical mask. That was something that we were discussing. We may agree or not, but I know that in South America they did a great job. So I give the microphone again to Carlo.
Okay, then as I tell you before, the first case officially was in Brazil was in the end of February, and I, like president of Brazilian Neurophysiology Society, of course, with all my colleagues, ask about a doctor like Dr. Jefferson Abrantes. He is from Rio, and his intensivist too. And together in March 18th, we did some orientations. I'm sorry, this is in Portuguese, but all this kind of, there are many recommendations about 30. I don't remember how many, but the main things is a mask and N95 and N95, but there is a problem because when it started here in Brazil, even the simple surgical mask was disappeared, and of course this 995 is come to very expensive, and now is easier than before. And of course N95 and protector and facial shield is very important too, with other things. And the next please. In now in there is a Latin America chapter of International Federation of Clinical Neurophysiology Task Force. The head of Latin America is a Brazilian, Dr. Paulo Quimaid, and other many guys from many countries, for example, Uruguay, Argentina, Colombia, Peru, Mexico, and sorry, maybe I will leave some people out, but this guidance for clinical neurophysiology examination, not just for EMG, but for for clinical neurophysiology, okay? Except intraoperative monitoring and other things. It's the same, but another things. The next, please. Now, sorry, this slides was the guidance when it was in pre-proofs, but now few hours ago, Dr. Paulik might send to me and I sent to Alessandro the free. You can have free without pay anything this article by Clinical Neurophysiology Journal. Okay, some neurophysiology staff recommendations. It's very some clinical neurophysiology staff with the risks factor should avoid conducting neurophysiology studies like pregnant woman, patient over 60 years, and with comorbidity like obesity, diabetes, high pressure, cardiovascular disease, lung disease, and immunosuppression states. Okay, like like we say to all people doing at every works. Okay, the next, please. And to the personal laboratory, the same, almost the same way to wear some protections. But I think this is very, very important. The personnel from laboratory need to know and to understand and to believe. This is very important, to believe policies to contain these infections. I said believe because we are in South America and Brazil. Some people think that this is it's not important. This is a small flu, like some important politicians say here in my country. But the personnel from laboratory neurophysiology knows and believe in these policies will be very good to all people. Next, please. Then I sent to Alessandro and just a little words about sterilization, disinfection, and cleaning from the CDC from US. And then you can see that sterilization is a process much more, much bigger than process to destroy or eliminate all microscope life forms. And disinfection is a little bit less process to eliminate most of organisms, bacteria, but not bacterial spores and animated object. This that we have to do. And cleaning, of course, you have to maintain clean all of your body and your laboratory. Okay. Then I think that's the next, please.
You have cleaning. You want to talk about this?
Yeah, no. This is not necessary now because,
okay.
But is very important. The next, yes, just to see that almost after 5 minutes to clean adequately, you can kill this the coronavirus. Okay, next.
Okay, so the
Yes,
problem of disinfection.
Alessandro. Alessandro, I have a question for you.
Yes.
An anonymous spectator asked this one. As for femoral nerve, we have to palpate femoral artery and then we stimulus, yes. But double gloves make yes. it difficult for us to palpate. Yes. Is there any solution to this? Thank you.
I think that in this case, if you learn and if you have automatism about taking off the gloves, then cleaning, then take another new pair of gloves, so you can use one pair of gloves. Is not the double glove is just an advice. Is not a rule. So everyone may try. Sorry, must it's compulsory. May try and then feel comfortable with this. I think also me by myself. I think that in some anatomical district may be difficult. So try and then you will see, because for the femoral nerve with one glove we are used, because figure out when we do the blood saturation exam, we have to take blood from the femoral artery. So we do it with a pair of surgical gloves. So try. It's up to you. You can try, and or you will see after some suggestion about the selection of patients.
Okay.
About sterilization and cleaning, some suggestion. Uh, if you like or you only have filters, keep in mind a strong disinfection, not with 70% alcohol, but maybe with the pure alcohol or other cleaners, then wash away, as Francois told me yesterday, or use steel stimulator with spheres or a small stimulator that may be easily cleaned with disinfectant, or in what we call the cold liquid sterilization. We have to consider it, and we must be true, because we always knew that these were single patient disposable electrodes, but sometimes we were used to examine many patients with just a set of electrodes. Now we have to consider that for every patient we must use one and throw it away. This I like very much. Francois, tell us something.
Yes, donc, this slide just to say that in daily practice, it is not tricky to clean large surface like a desk, chair, or table. What is tricky and boring is to clean little things, as ribbon meter, pen, or scratch. So, it could be easier before consultation you prepare individual set of these little things for each patient.
Just a second. I have to say that it is not easy to do all this with the gloves. For example, for the disposable adhesive electrodes, for example, sometimes it's very difficult to do with gloves, because it's not so easy. But
Yes.
we have to use with new technologies.
Okay.
Yes. We are all new in this field, so we suggest, but we also are at the beginning. So this is the problem. That's a discussion. And so maintenance and cleaning, a good thing is the alcohol mixed with the chlorhexidine. I like very much for instruments peracetic acid, even if the smell is terrible. And we have also, if we want to terminate the sterilization, before the single-use needle, the disposable needles for EMG, we were used to sterilize with some liquid and then put the needles here. So why that could be a suggestion to keep our things under a UVC lamp. But for sterilization, I pass the microphone again to Carlo.
Okay, and this is just to see that many, because the RNA virus, there is a external lipid membrane. Many medical disinfectants could be killed this coronavirus, And this is many of disinfectants. Of course, if you have just alcohol, 70% is very good. Okay, then I think, the problem too is some of these disinfectants that are very are not very good smell. Then you have to share with this smell with patients too.
Yes,
Okay.
and here you have the link for what is suggested by the American government. There is the most complete list about what is really active on coronavirus. I must thank Giorgio Facco, the engineer of Space Medica, who gave me this fantastic link. You will find it on the slides. So, just few words about electromyography with needle. This is not a problem because we were used to be careful with the needle, so it was considered before a risky procedure. Just now we have to clean and make disinfection of the cable. And they were asking before something about the ICU. This is a suggestion from one of my colleagues, is that when you go in a COVID-19 room or in an ICU with suspected case anyway, when you are at risk, it's better to have an EMG machine with the battery power or with a non-interruptible power supply, UPS. This is the acronym in English. So you don't have wires, cables touching the ground, touching the bed, and not taking bad things from the ground. And it's true that when you work in this department, you must be fully protected. And if you have also the highest protection from mask, and then you must be careful, clean and disinfect the machine, every patient. But if you have the possibility, think about a dedicated equipment that is left in that department. So when the problem will be solved, I hope you will take the machine again. So something about cleaning the machines. We have some people that thinks differently. Someone prefers to use directly on the machines alcohol-based wipes. I like, for me, much more. That was my machine with the PVC film, a cling film to cover, and because it's easier to pass the alcohol here on the surface to disinfect. You can do it, or you can change every patient. It depends on the time. But this is also protection for the machine, because if we use strong disinfectant, we will give damages to the machine. The people from a company told me that if you don't have a pneumatic keyboard, the keyboard maybe will have some damage. So, again to you,
Yes.
Carlo.
Okay. And then about this electronic device is almost the same that we are talking about during this speech, especially like Alessandro said this slide before. Electronic device such as telephone, tablets, touch, everything, remote controls, keyboards need to be eliminated if not necessary, and you can clean with alcohol 70%. Okay, and I think the other slide, please. Just a minute. I used to the PVC film too. Every patient I clean, and the end of the day I change to the other day. I change the PVC film. Okay, and here some ask some things to before start the diagnostic test. For example, there is a thing that I think it is not necessary, but you have to understand the context of the pandemic and the problems with judge obtain the responsible physicians approved for the CN study. Is it very important or not? I don't know. You have to see in your country, in your place, okay? And many things. For example, you don't need some things like you can remove, you and the patient remove jewelry, makeups, watches if not necessary, okay, and clean every day. Clean all surface of neurodiagnostic equipment, like we said before, and like I said before, plastic cleaner clean the cover plastic with plastic cleaner the equipment and all that you could touch. Not only you, but your secretary, everything. And of course, all cable have to be clean cleaned every patient. I know every day, every patient to do this is very boring, is very you be tired to do this, but as I said before, we are living in another world, and we have to think to need we have to protect ourselves, the patients, and the other patient that come too, and of course the staff, the all staff. Okay, I think the other, and after the diagnosis study, you can do the same things that we are talking about in this speech every slides. Dispose non-reusable electrodes material, of course, you don't need. Plan the cleaning procedure for the equipment and reuse material. Remove, like I said, like I showed before, the PPA, and wash hands with appropriate techniques, at least 20 minutes, 10 seconds for a wash robe, wash your hands. Proceed to disinfection process of diagnostic equipment. Remove the PA, perform a hand agent. Like we are talking, we have just to think that is necessary to change our mind. The next one. And laundry, if you are working in a hospital, then in a clinic you have the clinic routines. But if you are doing your examination in a private service like me, for example, I have a company, a health company that collect the medical waste, especially, and the laundry, another company. Okay, but of course, this is much more expensive to do an examination, like some months ago. We are talking about this before. Then I think is you again, Alessandro?
Yes, just a few words because we are really exposed every day to advertising about air cleaning, air disinfection. So some machines are working very well, like machines, aspirators with HEPA filters and UVC sterilizing. They start to have a portable one. One thing that we hear very much is sterilization by ozone machine. The problem is that for the moment, I think that it's very difficult considering the time of sterilization and the fact that the room must be sealed, and then you have wait a long time. If not, you may have secondary side effects from the ozone that are really severe. So in Italy, the Italian Ministry of Health in May 2020 said that there is no evidence that ozone performs a sterilizing function again. So you must use the classic liquid alcohol or hypochlorite disinfection because these are safer. But if you want to know this, try to refer yourself to an expert, to a company who does this job since a long time. So we are coming to an end, and just not a take-home messages, but the questions that still are open, because from what we told you before, we have maybe the problem, we are full of patients, and we have to make the rescheduling for a patient if he's not in the right condition, and this may be a problem for the waiting list. The impact on the examination length. We were discussing about the fact that it will take 15 or 30 minutes more if you think about dressing, undressing, cleaning, disinfection. So I hope that there's some suggestions will be useful. This will impact the daily number of patients. So the number of patients examined in a day will be reduced. Do we dedicate a specific session to a body district? I mean, one day we make lower limbs, the other day we make upper limbs, then the other day the face, and the other day the perineal nerve. This is partially an answer to the question before about the femoral nerve. If we work on the lower limb, maybe we can reduce the protection, and we are most at ease when we work. This is the ease while doing test wearing PPE. We must try how is fatiguing and tiring to wear all these things. We will have an impact on the ecological system, because we will increase the spatial waste. And
Alessandro, just a moment. A question from Enrique. Once a study is completed, floor disinfection is performed before moving on the other patient? About the floor. Do you understand?
Yes.
Yes, the disinfection of the floor, every patient, yes?
Mm-hmm.
Yes, it's a procedure.
Okay. I have a secretary that do disinfection the floor of my room, every patient, but it's not easy. My patient now is one per hour. Then I have time to do this.
If I can add something, is one if you want, you can make the patient wear the shoe protection, so you can avoid sometimes the floor cleaning, but in the 30 minutes everything is it's all inside. So this it's not taking a long time. You have also to change, if you can, the air, open the window. So it's a procedure that almost every patient you have to do. And we were talking about the fact that we are in shortage of personal protection. So may we recycle, disinfect, keep them at the air for 3 or 4 days after spraying alcohol and something above, so use them again. I must be true. Sometimes we do it because we can't find on the market all the protection. Still now, it's a problem. I just received this morning a message from a seller that the masks are stuck in the custom. We don't know for what reason. So that will be a problem. And rightly, Carlo was talking about the cost for each exam, because everything we calculated an average of 20 euros, $25 of money that we spend each patient, each exam. So we must consider the impact also on the financial problem of the EMG. The long-term exposure to disinfectants, side effects, that is the reason why I started to consider the double glow. And for the end, the last is theory versus reality. All we showed you is possible or necessary. This is just the experience that will tell us. And I would like to end to thank everybody. It's for me a problem, because I had many people in Italy in this month. We every day 10 phone call with my ex-colleague, with facial surgeon, dentist, people, the owner of the of the cabinets, people in the medical department, everybody was asking to the other, how can we do? So the suggestions are coming from this confrontation. I know that Carlo has a big thinking about the work. Because they made, I say it because for me that paper is fantastic. I'm very happy that it will be available from today. And a special shout go to my ex-colleague. I left the Neurological Institute 1 year and a half ago, but I'm still in contact. And especially because my former chief, Arrigo Moglia, some of you maybe met him in congresses, was such a kind person, died from COVID virus, as a lot of doctors in Italy. So that was the big problem we had. We faced ourselves with a new problem, and I hope that some of our suggestions will give you something useful. Thank you very much. We have a poll. I think that we will. Sorry for the end, but for me it was not a nice experience.
Thank you, Alessandro. Thank you, Carlo and Matteo.
Thank you, Francois.
Thank you very much for the panelists that have done a great job. Thank you for all the people that participate. So I'm ending the poll so everybody can also see the result. I'm just waiting a few seconds that everybody will reply.
We reached 200, more than 230 attendees, and I'm happy because they stayed with us until the end.
Yes, especially with my English.
The English is for communication. If not, we will call Boris Johnson the next time. So, who will give the results of the poll? Francois, you have it?
Yes, yes. Now I feel ready to work. 60%.
So that is maybe a good part of our job to give some information, and but there is also the other part. May you tell something that?
And at the question, no, they did not clear up my doubts. 0%.
Okay. And some people still they feel with doubts because it's a new problem that we don't know very much. Matteo, can you show the poll that we did before, the first one? You have the results?
Yes, let's see. Back. Here.
So, Francois,
yes.
You see it?
Yes. Alors, donc, how long did you have to stop your work for COVID-19? I didn't stop 25%. I stopped for less than 2 weeks, 5%. I stopped for more than 2 weeks, 36%. And I didn't stop, but I limited my patient only to few, 34%.
So it means that the majority.
Maybe the last two questions could be together too. Stop for more than 2 weeks and to limit patients.
Mm-hmm.
Yes. So it has an impact anyway, a deep impact on the reorganization of the job. Do we have some question, Francois, that you want?
I'm looking.
There is a question about the presentation. So if we both agree, we can then send on PDF to the people that participate.
Okay.
Yes, how can we do it? You have all the mail of the participants.
We can send by email.
Yes,
beginning
it will be,
of the week.
yes, and anyway, you will find easily on the web to contact us, I think, or via the email you received from the educational space. We will give to the other participants or to the other speakers everything. Just practical. I think that we do not have more open question.
No. No more
If you
questions,
put
I think.
if you put a protector of foot before to enter into the clinics, in my opinion, you couldn't clean the floor. I agree. That's what we were telling before. With the show protector, you can avoid the cleaning. We had another question very similar. That was the cleaning and disinfection of the room. So, Matteo, it's up to you to.
Guys, I think we have done for today. Thank you very much. And as I said, we hope this was useful. And have a nice weekend to everybody.
Thank you.
Thank
you. Grazie.
Bye.
Ciao, ciao. Bye, bye.
Ciao, ciao.
Hasta luego. Au revoir. Auf Wiedersehen. Matteo, chiudi.